Good morning. My name is Gary Coleman. Can you say your name for the record, please?
Good morning, Gary. My name is Naomi Alice.
And what is your candidate number, please?
My candidate number is 221145450.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and is a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you rate your skills working with patients?
My reason for going into nursing was to help patients get the best possible care. I try to see each patient as a unique individual. I like asking questions when I'm working with a patient to help him or her feel more at ease and to learn a little bit more about specific situations. Patient education is a vital part of the best possible health care. During my time with patients, I strive to ensure they have a complete understanding of possible risks when it comes to skin and the sun. I also give them recommendations about how to protect their skin.
Healthcare workers should be a model for people in health management. Tell me what your skin routine is like.
I start with cleansing my face. Then, I use an exfoliating product once a day in order to rid my skin of dead cells. Next, I treat my skin with a vitamin C serum to diminish the appearance of age or sunspots. The next part of my routine is to thoroughly moisturize. Finally, the last step of my routine is to generously apply sunscreen all over my face, which has helped my skin stay relatively healthy.
What do you do if a patient complains about being kept waiting too long?
First, when I finally am able to help the patient, I would apologize for the situation. I would explain that in order to achieve the best and most personal care, it's sometimes necessary to spend a few extra minutes with patients. Sometimes this makes the doctors get a little behind in their schedule, but most people would be understanding in this situation.
How do you make sure your relationship with your colleagues is beneficial when working together?
With everyone in the medical practice, the most important thing is to treat people with respect. It's also important to listen to people and to take time out of your day to say hello. I find that being polite and friendly, no matter what, makes a big difference.
What would you do if your patient, despite the doctor's advice, continues to do harmful things, such as not wearing sunscreen or going indoor tanning?
The first thing I would do is speak to the patient and tell about the possible problems that occur from these practices. Next, I would show possible outcomes if he or she continues to have these unhealthy habits. I find that using an ultraviolet light to find hidden sun damage is especially helpful.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. I'm Naomi Alice, one of the charge nurses in this clinic.
Good morning, nurse.
Can I confirm your name for the record, please?
Oh, yeah. My name is Gary Coleman.
Thank you, Gary. Now, the doctor's report says you have rosacea.
Ah, yes. Doctor said so.
Gary, you seem to be very nervous. If you don't mind, can you please tell me the reason?
It's quite hard to hear that there is no treatment for my skin conditions.
I'm sorry, Gary. Sadly, there is really no permanent treatment for rosacea. But it can easily be controlled.
Whatever? It's very disappointing to hear that.
I can understand your Gary. In some situations, we humans and science are helpless. And the only thing we can do is to accept the truth.
Yes, you are right, nurse.
Gary, in your case the skin condition rosacea can be easily controlled.
Dr. Tu said the same. I would like to know about it in detail, please.
Sure, I'll be very glad to explain it to you, Gary.
Thank you, nurse.
Make it mandatory, or what we can say is a habit, that you use sunscreen lotion and cream. It can reduce the redness in your skin.
Oh, okay. Will it have any sort of side effects?
No. Don't worry about the side effects. It is a protective shield for your skin. Thus, no harm or side effects are made.
Okay. My skin is delicate and I wanted to know whether it affects my skin tone or may cause any harmful disease like cancer or something.
I can assure you that these medications will not cause such changes like skin tone or cause any harmful disease like cancer.
But I'm not sure about when and how to use these body lotions and sunscreens. Can you please explain it to me?
Firstly, apply the sunscreen daily, which blocks both ultraviolet A and ultraviolet B rays. Apply sunscreen after you apply any topical medication you are using for your face and before applying any cosmetics. You have to apply the cream, which is prescribed by the doctor, on the affected area of your skin.
Yes, I can do that.
Take the medication, oxymetazoline, regularly, which is being prescribed by the doctor. This medication reduces the redness by constricting blood vessels, and you may see results within 12 hours after use. However, the effect on the blood vessels is temporary, so the medication needs to be applied regularly to maintain improvements.
Yeah, I understand the necessity of following your advice.
I can assure you that there won't be any such harmful effects to your skin.
All right.
Keep a journal of the foods you eat and the cosmetics you put on your skin.
But why?
A record on your diet and cosmetics will help you figure out what makes your symptoms worse. Also, it will be better if you can change your diet pattern and include nutritional supplements.
May I know about it in depth, please?
Of course. I can help you with the details.
That will be a very helpful, nurse.
Great. The cause of rosacea has not been determined. It may be a combination of hereditary and environmental factors. It is known that some things may make your rosacea symptoms worse.
Can you explain it more, please?
Sure. Eating spicy foods, eating items that contain the compound cinnamaldehyde, such as cinnamon, chocolate, tomatoes, and citrus, drinking hot coffee or tea.
I see. I can avoid these things without worries. Because, for me right now, this skin condition is the first priority.
All right, if you don't mind, shall I ask you a personal question?
Sure.
Do you drink?
Yes, occasionally.
I see, but for now, you should avoid alcohol to cease the worsening of your condition. Is it okay for you?
Yes, I am ready.
In addition, make sure to take care of your skin, using gentle cleansers and oil-free, water-based skincare products. Use a non-soap cleanser and moisturize frequently. Avoid products that contain alcohol or other skin irritants. Do not rub or touch your face too much.
All right, great.
Take some methods to protect your skin, such as wearing a hat and avoiding midday sun. In cold, windy weather, wear a scarf or ski mask.
Okay, I will.
All right, do you have any concerns regarding what I have discussed today?
No, not till now.
Great, so kindly follow my suggestion and I wish you a very speedy recovery.
Thank you so much, nurse, for your kind and positive approach, as well as for your suggestions.
You are welcome.
That is the end of your OET speaking roleplay. Thank you and all the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.